Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Effective home remedies to treat cough in children. A prolonged cough can be uncomfortable, especially for kids. While there's no shortage of OTC medicines, it's best to try home remedies first. Effective home remedies for cough in kids. 1. Get your child to gargle. It's best to gargle at least thrice a day. You can also add a teaspoon of salt to the water. 2. Give honey. An ideal way to administer honey is to mix a tablespoon of it in a glass of warm water and squeeze some fresh lemon juice into it. Avoid giving honey to infants below the age of 1. 3. Give ginger. Ginger is an excellent home remedy for cough. You can make ginger tea or extract the juice of ginger and mix it with little honey for consumption. 4. Inhale steam. Steam therapy is a good option for blocked noses and coughs. Boil water in a bowl or a tub and add a few drops of eucalyptus oil to it. Allow your child to inhale the steam. 5. Use a humidifier. A humidifier helps expel mucus and provides relief from a wet cough. Be sure to keep the humidifier clean to prevent mineral buildup and the growth of bacteria and molds. 6. Chicken soup. Chicken soup has anti-inflammatory properties that relieve sore throat, cough and congestion. 7. Turmeric milk. Turmeric is an age-old home remedy for sore throat and cough. Add a teaspoon of turmeric to warm milk and give it to your child every night before bed. 8. Administer cough drops. Cough drops give temporary relief to a sore and scratchy throat. However, cough drops should not be administered to children under the age of 3. 9. Use a suction bulb. A suction bulb effectively works for 6-month-old babies to clear mucus. Just squeeze the bulb, put it into the nostril and release gently. Repeat after 2 to 3 hours. 10. Administer warm saline water or saline drops. Mix half a teaspoon of salt to warm water. Put 2 drops of the solution in your child's nostrils. Ask them to blow their nose immediately to remove the mucus. 11. Focus on hygiene. Keep the surroundings clean. Wash and change the bed linen, handkerchiefs, towels, etc. frequently. Get your child to wash her hands or use hand sanitizer before eating. Use these home remedies and provide a healthy diet coupled with a clean environment. If the cough shows no signs of going away, visit a pediatrician without further delay.